Good day. Thank you for joining us on Nationwide. Well, we're starting a bit late. You're aware the Presidential Task Force on COVID-19 daily briefing just ended. But here is the news. I'm Ruth Aguele. We begin with an update on COVID-19. 8 new cases of COVID-19 have been confirmed in Nigeria, bringing the total number of confirmed cases to 232 as at 9:30 p.m. Sunday. Of the 8 new cases, 5 are in Lagos and 2 in the FCT and 1 in Edo. 33 of the 232 cases in Nigeria have been discharged, while 5 fatalities have been recorded. A multi-sectoral National Emergency Operations Center, activated at Level 3, continues to coordinate the national response activities. All right, let's look at the briefing that just ended, talking about the Presidential Task Force on COVID-19. It says the support coming from Chinese company is part of corporate social responsibility initiative to boost Nigeria's capacity in managing the coronavirus pandemic. All countries of the world seeking for help and receive help in the fight against COVID-19, and Nigeria is not an exception. Chairman Presidential Task Force on COVID-19, Boss Mustafa, said this at a briefing on the intervention of Chinese in Nigeria for the fight against the disease. He said Chinese is only providing technical support and shall in no way be involved in case management or interface with the patients, noting that the task force recognizes and respects the competence and capability of Nigerian doctors, but appealed to medical professionals to see the Chinese gesture as an extension of development in the field of medicine.
There were 224 confirmed cases with 5 deaths across 14 states in Nigeria. The government of Nigeria continues to take stringent steps to contain the spread of the disease and manage confirmed cases. Testing capacity has been expanded and shall continue to expand. Currently, 2 states and the FCT are under lockdown on the authorization of the president, but several other states have put measures of restrictions of movement within their territories.
Right, the chairman of the Presidential Task Force there giving an update. Let's take you to Osun State, where we hear one of the early confirmed cases of coronavirus in Osun State has been discharged after testing negative twice for the virus. Governor Gboyega Oyetola made this known during a press briefing on the current situation in Osun State. Let's hear from Femi Afariogun.
First COVID-19 confirmed case in Osun State was recorded on the 25th of March, a returnee from the United Kingdom who voluntarily submitted himself for testing and treatment. Unfortunately, since then, the number has risen to 20 confirmed cases. The good news, however, is that one of the earliest cases has returned negative.
It gives me great pleasure to announce that we are discharging one of the earliest cases from our facilities here in Osogbo after testing negative twice, in line with the prescribed protocol of the NCDC.
However, out of the 127 returnees from Cote d'Ivoire in isolation, 18 has been confirmed positive for COVID-19, while 109 returned negative.
All the returnees who tested positive are intact at our facility and are undergoing adequate and proper treatment at our care center and are stable. The 109 whose results came back negative have been released to join their families.
On the lockdown, The state, according to the governor, will soon deliver relief items to those who deserve them across the state. In Oshogbo, Femi Afariogun, NTA News.
And in Oyo State, it is good news for the state governor, Seyi Makinde. He has tested negative for COVID-19 for the second time. In a statement, Governor Makinde assured to resume work immediately. Take you to Damaturu. Veterinary personnel under the auspices of a Yobe State Pilot Livestock Development Program have embarked on sensitization campaigns against the spread and prevention of COVID-19 to abattoir, poultry and livestock markets in the state. Now, this is coming on the heels of increasing cases of the virus infecting people around the country, and therefore the need to carry on board people working in the livestock sector of the economy. Mustafa Yusuf Musa has that report.
The world continue to grapple with COVID-19 and Nigeria recording cases on daily basis. Intensification of preventive measures in all public places becomes imperative. Toward this end, a team from the Yobe State Pilot Livestock Development Program, led by the program manager, Dr. Yusuf Madaki, took sensitization campaign to Damaturu abattoir, poultry and livestock markets, where the message of environmental and personal hygiene were delivered to workers in the face of COVID-19 threat to people's life.
There is need for us to sensitize our stakeholders on basic hygiene, sanitation, as well as other preventive measures to curtail not only the ravaging COVID-19, but other zoonotic diseases.
Though no scientific proof was established as whether coronavirus is transmitted from human to animal or vice versa, however, the idea of being safe becomes necessary, says Dr. Yusuf Madaki. In all the places visited by the team of veterinary personnel, they encourage and advise the people to observe social distancing, washing of hands with sanitizer and soap, use of face masks as they conduct their businesses. In Damaturu, Mustafa Yusuf Musa, NTA News.
The federal government says it is not only dependent on healthcare materials from outside the country, but has since been looking inward on locally made products. Permanent Secretary, Federal Ministry of Health, Abdullahi Mashi, said this when receiving some COVID-19 prevention items from members of the Pharmaceutical Society of Nigeria in Abuja. Olusheye Adegbo will tell us more.
Cases of coronavirus in Nigeria might be rising, but health workers and partners are not to be relenting in their efforts towards ending the spread as supports continue to increase, especially to workers on the front line, and taking note of the unavailability of some necessities like hand sanitizers and face masks at a public place like the Ministry of Health. Members of the Pharmaceutical Society of Nigeria, PSN, donated protective kits.
Little widow's mite to the Federal Ministry of Health.
Receiving the items, Permanent Secretary, Federal Ministry of Health, Abdullahi Mashi, appreciated the gesture, hinting on the government's intention to encourage homemade health products in the fight against the pandemic.
We are meeting with the manufacturers group to see how all these commodities and supplies that we can make use in fighting the virus, that we can empower the local industries to manufacture and source them here locally.
The PSN Deputy President note, pharmacist Muniu Elelu said the materials presented were produced in Nigeria.
There's nothing that our manufacturers cannot produce in this country in terms of essential medicines. And we're up to the task. And now that the government has decided to look inwards, we're happy with that. And will not let the government down.
He assured of its members' readiness to keep cooperating with government. Demonstrations so far have since been portraying COVID-19 as an unseen enemy, and the fight against it is likened to a war. Actions therefore keep indicating that collective response is the key requirement. In Abuja, Olusheye Adiagbo, NTA News.
Thank you, Shaye. Now it's day 2 lockdown in Akwa Ibom State, and socio-economic activities have been put on hold in the state as security agencies commence full implementation of the cessation of movement ordered by the state government. The order came following confirmation of 5 positive COVID-19 cases in the state by the Nigeria Center for Disease Control. Clement Barricue, who monitored the situation in Uyo, now reports.
It is already day 2 of the cessation of movement in Akwa Ibom State, a difficult but inevitable action taken by the state government to curb further spread of coronavirus pandemic, which the Nigeria Center for Disease Control confirmed stood at 5 cases in Akwa Ibom. Major roads and streets are devoid of the usual hustling and bubbling, with adequate security personnel on ground to enforce the order. And as would be expected, the order is unleashing its toll on residents.
It is better we obey the lockdown. I know it's hard because it's very scary. Somebody like me, I don't like staying idle.
No food, no power supply, so you don't expect to stay at home not being productive.
This total lockdown order was to enable people maintain social distancing, but observation reveals that rather than staying at home, many residents choose to gather in cluster by the roadsides, while others take advantage of the empty roads to play football. It therefore left one to wonder if the lockdown was only meant to check vehicular movement.
That still falls back to awareness. Some people are not taking it serious.
Governor Domimane had earlier signed into law the Quarantine and Restriction of Movement Regulation 2020 to provide legal basis for the stay-at-home order. In Uyo, Clement Barricue, NTA News.
Now, in line with the presidential directive to cushion the effect of coronavirus pandemic, vulnerable and low-income families in Jigawa State, estimated at over 70,000, are beginning to enjoy from the disbursement of the conditional cash transfer funds in the state. Ibrahim Billogunda reports that it was a life-changing story for some of the beneficiaries. Let's say that.
A widow and mother of 4, Hawa Inua, alongside other beneficiaries in Jigawa State, share a common story on how the scheme transformed their living condition.
Kasuwa ta ya faɗa tun da a da ina ɗaukar buhun gyaɗa ɗaya amma yanzu buhun gyaɗa nake ɗauka ya kai 3 misali. Mun yi wa Allah godiya ba abin da zamu ce gwamnati wannan gwamnati sai dai Allah ya biya ta Allah ya saka mata.
It is heartwarming that beneficiaries who take home 5,000 naira monthly in the past now receive 20,000 naira each to cover a period of 4 months from January to April to help in boosting petty business and meeting up other needs of their families.
And if you compute the number of beneficiaries, we started with 22,000 beneficiaries. Now with the current data, we have more than 100,000. So this means more than 1 billion naira has been injected to our economy during every payment cycle. This is the payment at the baseline. And if you add up the top-up and the livelihood component that is also part of this program, is more than 1 billion naira, or maybe you're talking about 1.5 billion naira being injected into the economy of Jigawa State directly into the hand of these beneficiaries.
The disbursement, which goes hand in hand with measures to curtail possible infection spread of the coronavirus pandemic, is expected to cover 9 out of 27 local government areas of Jigawa State. In Dutse, Ibrahim Bellogunda, NTA News.
Well, let's talk more on COVID-19. We know with the outbreak of the coronavirus pandemic, it has given rise to many people, indulging in self-medication. We join our guest live now in Lagos. He's the president of the Pharmaceutical Society of Nigeria, Mazi Sam Owambua. I hope I got that right. Okay, now, Mazi, if you can hear me loud and clear. Now, we know that self-medication, drug abuse is one issue, one disturbing social problem that Nigeria has been grappling with for a very long time. Now, with the outbreak of COVID-19, there's this disturbing upsurge of self-medication from people. What's your take on that?
Well, I think that it is a natural escalation in a situation where people ordinarily have had to take care of themselves. But the major issue is that in self-medication, there are certain conditions that you are allowed to self-medicate when you have simple illnesses, because the idea is that if everybody who had a headache had to go and see a doctor, then the doctors will have no other time to see other people. So have some simple remedy, you have a little cough, you have a little headache. But today, people are going beyond that and keep medicating themselves. And what is worse is that if you take medicines for the wrong reasons, in the right doses, in the right sequence and frequency, you are indirectly poisoning yourself, because every medicine is a potential poison if not taken the way it is prescribed. And with the fear and the panic in the air today, many people are being motivated to go and self-medicate with all kinds of concoctions that are being bandied around. My advice to everybody is to go and seek the recommendation of your healthcare professionals. See your doctor for prescription, and before you take any medicine, see your pharmacist for counsel and advice. That is the way you will avoid replacing one illness with another one.
All right, Mazi, and following the pronouncement of U.S. President Donald Trump about the efficacy of chloroquine for the treatment of COVID-19, and some comments by some experts around the world. Now, we saw people, taking on the drug, talking about chloroquine. We saw panic buying and all of that. What are the consequences of such action?
I'm really embarrassed that President Trump is actively promoting self-medication, which might lead to self-abuse, drug abuse, and drug misuse. I am really, really embarrassed seeing him consistently promoting such a medication in the air. If this is a proven medication, or even an experimental medication, it is for the healthcare team providers to decide which patient qualifies to be put on this medication at this time. I don't understand the motivation, but it is a dangerous thing because, as I said earlier on, every medication that is not taken for the right dose or right indication, which is not taken in the right dose, right timing, and with the right framework of body conditions, will tantamount to creating more problem for yourself. So this tendency for people to go and self-medicate is not right. Of course, there are certain things which you are allowed to take care of yourself. Take things that can help you to boost your immunity. Eat good food, take some minerals and a few of such things and vitamins that can help you boost your immunity. But maintain the conditions that have been prescribed. Wash your hands, maintain social distance, and as much as possible, stay away from crowds. The moment you do this and you have any indication, then go see your healthcare practitioner, go see your doctor, go consult your pharmacist for advice before you take any medication. Otherwise, you are causing trouble for yourself and then maybe people around you. So I will caution everybody who wants to take a medication, if it's not the one that is prescribed by your doctor or the one recommended by your pharmacist, then you just don't have to take them. Every medicine has a problem associated with it if not properly taken. And that's the issue, because when we go past COVID, we're going to have other consequences that may emanate from the abuse of some of these drugs that are being bandied. Right now, government is NAFDAC has approved the clinical trial of some medications, including the one that is being promoted, the hydroxychloroquine and chloroquine. They may have some potential benefit, but science believes on data and evidence. And until that is fully accomplished, then nobody should take it. I believe that in the centers where they're doing clinical trials, they are putting patients on different protocols. And after that, a body of knowledge will be available. There is no time anybody should recommend for you to go and self-medicate on issues related to COVID-19. It's a dangerous exercise.
Mazi, you mentioned immunity booster earlier. Now, I know the crave for it now is really high because people are trying to boost their immunity. From what you're saying, are you saying people should just go for any immunity booster, or are there specific ones people should look out for?
There are standard things people take generally, especially if you have symptoms. If you have cold symptoms, you have flu symptoms, if you have all those kind of symptoms, then you know that your immunity is challenged. The body's immunity is very, very, very robust, because if it weren't for the body's immunity, every virus, every bacteria will be beating us and causing problems. The body is well equipped, but you support it by taking the right meals and the right vegetables and fruits and taking enough rest. But there are things that are known, generally known, like vitamins, vitamin C, some of the other products that are vitamin, not every type of vitamin, but there are immune boosters that we know that come from natural sources, which is what I think people can take. There is glutathione, for example, which is now in different forms. That is also a known immune booster, because if you have a compromised immune system, you can boost them. But those ones are safe to take because they are naturally occurring things, and you hardly can take overdose of them. But anything outside these minerals and naturally occurring immune boosters, you must seek prescription, you must seek recommendation. That is the advice the Pharmaceutical Society of Nigeria is giving to every Nigerian, because we want Nigerians to be well, to be sick, and to be well and not to be sick. And to maintain that good health, it's a combination of your diet, your exercise, your mental state, and your inner well-being. I want to say that pharmacists are in the war front today with other healthcare professionals fighting this disease, providing the medicines. And I want to use this opportunity to continue to ask them to counsel the patients who come, whether they are community pharmacies or pharmacists in the hospitals, first to put down their level of panic. Panic will not help. Trying to take in all kinds of concussions will not help. So we need a lot more effort by pharmacies to continue to counsel patients so that they will get the best of the recommended products for managing this illness. Today, the most effective one is maintain personal hygiene, maintain social distance, and have plenty of rest. Luckily, government has granted us opportunity for rest. Let's go and rest, except you have to go out. If you're on essential services like I am, or the guys in NTA are, then you go out and you go back to your home and rest.
Very much, Mazi Sam. I know you have so much to say, but I'm sure Nigerians will heed to some of the things you have mentioned today on, not indulging in self-medication. All right, let's look at the economy now. President Muhammadu Buhari has given approval for a 500 billion naira stimulus package to keep the economy going after crude prices fell more than half the budgeted benchmark in the wake of COVID-19. Let's hear from Leah Katuma Batunde, who was at the Ministry of Finance, Budget and National Planning.
The year 2020 was one so many people envisaged to be significant, and there were high hopes, but no one expected that a virus called Corona was going to come in and dampen global economies, bringing major markets to their knees all around the world, and Nigeria is one of those economies that were badly hit, especially with the falling oil prices.
The decline in international crude oil prices and domestic production may be magnified if a severe outbreak of COVID-19 occurs. Despite ongoing efforts to curtail the spread of the pandemic through compulsory lockdown of Lagos, Ogun, and the FCT, we still have to be very mindful that this can be aggravated.
Now, the president just last week approved a 500 billion naira stimulus package to put the economy back in shape. And given the breakdown, Minister of Finance Zainab Ahmed say the package is essentially to get Nigerians back into their jobs and profit making, and also to assure that there is liquidity in the hands of Nigerians.
Mr. President has also approved that the Ministry of Finance, Budget and National Planning should engage with the Central Bank of Nigeria to agree on a debt and interest moratorium for states and for the federal government on CBN-funded loans in order to create fiscal space for the states and the federation. Accordingly, once average monthly receipts fall below a specific threshold that we and the states will determine, The interest and capital repayments will be suspended till a healthy pack is attained.
In Abuja, NTA News.
Many thanks, Leah. Let's now go to Lagos to join Hingino John Adams to bring us more reports on Nationwide. Hingino.
Thank you, Ruth. The 14-day lockdown to contain the spread of deadly COVID-19 is a crucial step to save lives. As this all-important step is ongoing, Lagosians are of the view that adequate monitoring and welfare are critical to preventing scenarios that can complicate the situation. Jennifer Igwe, who visited the Abuja disaster site and another area of Lagos where a pipeline leakage occurred, tells us more.
These scavengers and a few bricklayers at the remains of the Abuja disaster have locked up their minds at the lockdown directive to contain the spread of a deadly virus capable of triggering disaster bigger than the sites where they are.
The hungry, they catch us at home. That is why they come out to come and find the thing where we go hit.
For a few victims of the Abuja explosion still hanging around, their submission is not that of disobedience, but search for a roof over their family's head.
I don't know anything about COVID-19. I know only about myself. If I have a home, then I can be at home. But now I don't have a home.
The lockdown in Lagos aimed at curbing the spread of the deadly coronavirus would have taken a dramatic turn in this area, Kakatin, under the Muson Okuola local government development area in Alimosho, Lagos. But for the timely intervention of officials of the Lagos State Emergency Management Agency and the NNPC, a pipeline leakage threw residents into panic. Apparently, the pipeline had been vandalized in the past, but was fixed by officials of the NNPC. A heavy wind, however, reopened the leakage point.
The whole community started smelling, and before we could, nobody can come out. I don't understand. Nobody can come out because it is, and that's when the wind is blowing.
One thing is pertinent, the need for safety in all areas, so that while trying to save lives from the tsunami-like virus, another catastrophic disaster does not make mockery of all personal and national efforts. In Lagos, Jennifer Igwe, NTA News.
Now, Nollywood actor and producer Funke Akindele Bello and her husband Abdurrashid Bello have been found guilty of violating the social distancing order placed by the federal government and sentenced to 14 days of community service of 3 hours per day, excluding Saturday and Sunday. They are also to pay a fine of 100,000 naira each in a judgment passed at the Magistrate Court, Ogba, Lagos. Each of them must visit 10 important public places within the state to educate the public on consequences of non-compliance with the restriction order. They are also to submit the names and phone numbers of every person who attended the party. The couple would also be placed on isolation by the state government to determine their COVID-19 status. Failure to abide with the court judgment and directives will attract more severe punishment. Funke Akindele, popularly referred to as Jennifer, and her husband were accused of holding a birthday party at their residence on Sunday with more than 20 people in attendance, contrary to the social distancing order. The suspects were arrested after a viral video of a large number of persons. That's it from Lagos. We now take a break. Nationwide continues after that with Ruth Aguele.
Many thanks for staying with us. Even with zero confirmed case of COVID-19, the Adamawa state government is doing everything to prevent the spread of the disease. Mohammed Saidu has more on that.
Adamawa State is one of the states that have so far not recorded any confirmed case of coronavirus since its outbreak in Nigeria. But that is notwithstanding, the Adamawa state government is not resting in its responsibilities in ensuring that the deadly disease does not find its way into the state, or if it eventually confirmed, measures to curb the spread are well on ground. These measures include setting up and equipping an 18-bed capacity isolation center in the Yola Specialist Hospital and training of health personnel that will handle any confirmed cases should there be one. Sensitizing the public on the need to maintain personal hygiene as well as state lockdown to curb the spread of the virus. Inspecting the equipment donated to the state recently by the Northeast Development Commission at the isolation center, Governor Ahmadu Umaru Finturi said the state is making frantic efforts to save the lives of its citizens.
We've come round to continue to see how prepared the committee are and our hospitals and the facilities should, in case, if we have a case, that this state can handle and to ensure we don't lose a life.
The Secretary to the State Government, Bashir Ahmad, who is also the State Chairman COVID-19 Containment Committee, in one of his daily briefings said individuals and corporate bodies have started responding to the call for assistance because so far the sum of 33 million naira has been realized with a donation of an 8-bed capacity temporary isolation center by Musa Garba.
We are still looking for space where we can have bigger facilities that can take 100, 200 as a containment area.
To serve as a palliative measures against the hardships of the state lockdown, the state government has directed for an immediate release and distribution of food items to the 21 local government areas of the state. In Yola, Muhammad Saidu, NTA News.
The current scourge of COVID-19 in the country necessitated state governments to mobilize resources to establish isolation centers to cater for any eventuality. Abdul Malik Hassan gives an update on the preparedness of Kaduna State against a possible outbreak.
With a population of about 7 million people and located along the Nigeria-Niger Republic border, the government of Kaduna State adopted some measures to guard against any possible outbreak of coronavirus pandemic among its people. Aside the intensified public enlightenment, ban on crowded gatherings, and shutting down of its boundaries with other states, Kaduna State government directed for the construction of a modern isolation center to be equipped with required medical facilities. However, as at the time of filing this report, the state government is relying on the 12-bed capacity isolation center located at the Federal Medical Center, Kaduna.
We have the Federal Medical Center, where we have some isolation center or isolation wards where serious cases that require special attention would be taken to.
Co-chairman Emergency Preparedness and Infection Control Committee of the Federal Medical Center, Kaduna, Dr. Sanda Abdullahi told NTA that the isolation center is ready to receive possible patients of COVID-19.
In the event we have cases of suspected or confirmed COVID-19 infections in Kaduna State, I think we are partnering with the state government to ensure that all that will be needed to care for those patients in the event we have such in the state in place.
Dr. Sanda says a medical team is currently undergoing training on how to handle patients with COVID-19. In Kaduna, Abdul Malik Hassan, NTA News.
All right, let's head to Maiduguri to join Abubakar. I'm sure we'll get more awareness on coronavirus in the rural areas of Borno. Abubakar.
Oh, you can say that again, Ruth. Good afternoon and thank you for joining us in Maiduguri. Rural communities in Borno State have stepped up efforts in sensitization and compliance with the preventive measures put in place towards curbing the spread of COVID-19 through inauguration of committees on public enlightenment. Memuna Garba examines rural communities' involvement in the fight against the pandemic.
Since the reported case of COVID-19 in Nigeria, Borno State government has not relented in its efforts towards ensuring the dreaded virus does not find its way into the state, as stringent measures have been adopted to minimize its toll in the event of any reported case. the setting up of a high-powered committee on COVID-19 and the isolation center, restriction of cross-border passengers and vehicular movement, as well as ensuring the citizenry observe the social distancing and station of hand-washing facilities in all business points, financial institutions and crowded places were some of the preventive measures put in place by government. Those at the rural areas were not left out, as local government councils took the campaign of coronavirus pandemic to their populace, where community, traditional and religious leaders are carrying out massive campaign against the pandemic. The involvement of these leaders is necessary to enable the campaign reach all nooks and crannies of every local government area, including IDP camps.
Created another subcommittee. That is, most of the local government, we have a village units, ward levels. Then we now make this subcommittee for them to be lightened and then in case of any incasity. And then we urge them to be washing their hands as duly mobilized.
Fumigation of places of worship and communities is also ongoing to prevent outbreak of coronavirus, in addition to germicides given to the people to protect themselves.
Royal Highness the Show of Borno direct all the district heads and the village heads and the ward head to create awareness.
Health personnel in the rural areas have also been mobilized and are on standby for any eventuality with ambulances and other medical facilities. In Maiduguri, Maimuna Garba, NTA News.
Still on the COVID-19, women in Borno State have also taken awareness campaign on coronavirus pandemic to Maximum Security Correctional Center in Maiduguri with a call on the inmates to maintain personal and environmental hygiene always. Pauline Kujevana reports.
Coronavirus spreads like wildfire, hence social distancing and proper hygiene method is recommended at this trying moment. It is against this backdrop that Commissioner of Women Affairs, Zuera Gambo, led other women to Maximum Correctional Center to sensitize the staff and inmates on COVID-19, considering their vulnerability in terms of congestion.
We want to draw the line, governor, and be proactive, and encourage our people to wash their hands. We believe this community is a community that needs to be sensitized.
Deputy Controller Correction in charge of the Maximum Custodial Center in Maiduguri, Nuhu Hussaini, was appreciative of the visit and awareness on the pandemic and expressed hope that the plight of lack of enough hygiene facilities will be met.
Government and everybody is aware that a community is here. That is why this thing is extended to us.
Similar exercise out with the image of Canada, where some of them thank government for having them in mind with the awareness and appeal for decongestion against the dreaded virus, while the Commissioner pledged to forward the plight to government for necessary action. The group centered its message on the need for proper hygiene among the inmates and report any sign and symptoms of COVID-19. In Maiduguri, Pauline Kujevana, NTA News.
That will be it from Maiduguri. Let's now return to Ruth in Abuja. Good afternoon.
Many thanks, Abubakar. And from Maiduguri, we're going to Jalingo, where compliance with the partial lockdown of markets and other business activities directed by Taraba State government is mainly observed in the state capital. Joseph Austin reports that many in the rural areas claim ignorance.
On the 3rd of March 2020, the Taraba State government directed markets and other businesses to lock down for a period of 2 weeks and allowed authorities to observe situation regarding the spread of coronavirus. It exempts food and medicine dealings as well as essential movement. The usual congestion at the Jalingo main market disappeared and roads were deserted on commencement of the lockdown. People walked long distance to their destinations following suspension of movement by tricycle riders.
Thank God that people understand it and are compliant.
My sis with Lego, I reached my Dasa. From my Dasa now, I want to reach Magami with leg. I beg, Meguna pray, let this coronavirus go.
Security agencies were deployed to strategic areas and others patrolled the town to ensure compliance. Foodstuff markets still witness beehive of activities, but transportation of goods to many markets pose major challenge.
Kusan ga kanan asara ke sayarwa kasancewa ba za da bi kayan zuwa sassan wurare da ake kai kayan domin a kasa ba.
In the rural areas, however, the lockdown was not observed. In Adokola, and Takum local government areas, it was business as usual. Many claimed ignorant, while others saw it as unnecessary. For some analysts, it is clear that more sensitization is needed at the grassroots, and food markets must be restructured by authorities to maintain social distance. In Jalingo, Joseph Saundu Otsen, NTA News.
In Benue State, the government has closed Grace Cottage Hospital, Makurdi, for 14 days. If we recall, it is the hospital where the index case patient of COVID-19 was treated before her transfer to an isolation center. The Deputy Governor and Chairman, COVID-19 Action Committee, Benson Abono, disclosed this during the training session of pillars of the committee on operation responses of cases of the virus. Let's hear from Charles Abba.
The training program organized for all the pillars of COVID-19 Action Committee is to equip them for effective operation response to all emerging cases of the pandemic. Chairman of the committee and Deputy Governor of Benue State, Benson Abonu, who charged the trainees to be properly guided, noted that there is no vaccine or cure for the pandemic for now. He also stated that since the one index case recorded in the state, there has not been any other cases. He further disclosed that 23 of the persons who had close contact with the patient, as well as staff of the private hospital where she first received treatment, have been traced and have been isolated. The chairman added that the private hospital in question has been closed down from public use. He also affirmed that members of the Benue State Executive Council have agreed to donate 100,000 naira each to fight the pandemic for 3 months.
It is meant to equip you operators to protect yourselves from.
It's a simulation exercise because we want to test how ready the state is in the event that we have a case of corona.
The trainees were divided into 6 groups for effective understanding of the exercise.
Well, the take-home message basically is that you do not go to war and then become a victim yourself. So everybody that is here today is part of the process of ensuring that we regulate and ensure that COVID-19 doesn't get into Benue State.
The essence is to build or even to remind people of updated skills in each area, thematic area, where we put together all our efforts and coordination to make sure that we get the maximum out of management of such an epidemic.
The participants were drawn from the medical, clergy, security personnel, Nigerian Red Cross, and the civil society. In Makurdi, Charles Abba, NTA News.
And Port Harcourt is our next stop on Nationwide as we join Jenny to give us more reports. Jenny?
Thank you very much, Ruth. Good evening and welcome. River State government has set up a 24-man committee to coordinate the palliatives aimed at mitigating the effects of the coronavirus pandemic. Governor Nyesom Wike announced this and ordered decisions to contain the spread of the disease in a special broadcast. Chazalam Ikie report.
The committee, made up of members drawn from the different strata of the state, are to ensure effective distribution of the palliatives.
Government has decided to set up a committee to work out modalities for the smooth implementation of this directive. This committee reflects all interest groups.
Governor Nyesom Wike frowned at the non-compliance with the social distancing measure by commercial operators shortly before dissolving the River State Transport Company Board.
Government took this measure because the franchise scheme of OTC has become notorious for illegal activities that compromise the interests of the state.
He directed all borders to remain closed and announced the reopening of all but 3 markets on April 7 and 8 between 7 o'clock in the morning and 12 noon.
After those 2 days, the markets will remain closed. This is to enable residents shop for Easter and also replenish their stock of foodstuffs.
While thanking all well-meaning individuals and religious leaders for their cooperation towards containing the scourge, he announced that the index case has been confirmed negative and the results will be made public. Chiazalam Eki, NTA News.
And the commencement of the federal government's conditional cash transfer to vulnerable Nigerians to cushion the effect of the coronavirus pandemic is receiving commendation from Port Harcourt residents. Yanikume Ululu reports.
The conditional cash transfer is a federal government initiative. The poor and vulnerable group in Nigeria are identified, documented, and given 5,000 naira monthly. 20,000 naira is currently distributed to every vulnerable household in Nigeria, which covers 4 months. This is in compliance with the President's directive to cushion the effect of the COVID-19 lockdown in Nigeria.
For me, it's a welcome idea. It will help the person at least to live his daily life within that amount.
Or if the federal government can actually give some money to some people, it will go a long way to help them.
Some respondents appealed to government to extend the welfare package to all the states of the Federation.
It's a welcome development, but we want it to go round.
If these things can get to the people that these monies are meant for, people will be happy.
The social welfare package target is to ameliorate the sufferings of the vulnerable citizens. In Port Harcourt, Yanikume Ululu, NTA News.
And if we are done from here, it's over to you.
Many thanks, Jenny. Now, I'm sure you're aware that there is a scientific basis for the effectiveness of alcohol-based sanitizers for killing commonly transmitted bacteria and viruses. Although hand sanitizers can help reduce the risk of contracting certain infections, medical experts say not all sanitizers are effective against coronavirus. Udwak Etim will complete the story.
Regular hand washing with soap and water remains the most effective method of preventing the spread of infectious disease, including coronavirus. Hand sanitizers can also protect against disease-causing microbes, especially in situations where soap and water are not readily available. Medical experts who identified 2 types of hand sanitizers to include alcohol-based and alcohol-free explained that sanitizers with less than 60% of alcohol are found to be less effective at killing bacteria and may only reduce the growth of germs.
One layer of fat is easily dissolvable by the alcohol contents of the hand sanitizers, and it can be easily dissolved by just ordinary soap that we use in everyday life, which is why washing your hands frequently is the most popular recommendations worldwide.
Recently, the advent of the dreaded coronavirus has prompted an increase in the sales of hand sanitizers in Nigeria. While there is scarcity in the product, some people are now making homemade sanitizers, which many believe may not be effective to kill the virus.
How do you know the quantity of alcohol in your hand sanitizer? Put it in your hand, rub it. As soon as you rub it, you should feel the coolness.
Medical experts, however, advised that if hands are dirty, hand washing with soap and water is still the more effective method to prevent the spread of the virus, even more than alcohol-based sanitizers. In Uyo, Udwak Etam, NTA News.
Many thanks, Udwak, for that update. Let's take a break. We're back shortly, so stay. Time now to join Zulay in Kaduna for more on Nationwide. Zulay?
Thanks, Ruth. Good evening and welcome. There are indications that Kaduna State will soon have a COVID-19 testing facility. This means that results of suspected cases can be ascertained on time and spreading of the virus will also be curtailed. Achari Maxwell reports.
Coronavirus is real. It knows no bounds. It goes beyond social status, race, and geographical affiliation, ravaging humanity. This is why efforts are on at all levels to contain its spread. Besides other measures, medical experts say testing of samples of suspected cases will help to provide early management and contact tracing to control its spread. Kaduna State is upgrading the biosafety lab at Nsoho Memorial Hospital, Kaduna, to strengthen preparedness and response against COVID-19. Deputy Governor Dr. Hadiza Balarabe led a team of medical experts to the center ahead of the scheduled visit by the National Center for Disease Control for validation and final assessment. In the days ahead, Kaduna residents will be looking forward to this facility upgraded and put to use as COVID-19 testing lab so that samples from this part of the country will not have to travel far for tests. In Kaduna, Achari Maxwell, NTA News.
And still on COVID-19, in spite of the 24 hours curfew imposed by Kaduna State government to control the spread of coronavirus pandemic, commercial activities have continued unabated at Kula Village Market in Gidangayang Igabi local government area of Kaduna State. Suleiman Abdullahi Gachkum reports.
It is a special day for Gadargayang Market and communities in the village and environs. While the streets in Kaduna metropolis and environs are deserted in compliance with the stay-at-home directive by the government to prevent the spread of coronavirus pandemic, here at Gadargayang Weekly Market, it is business as usual. Transactions from livestock to foodstuff and other consumables were on top gear. Although they are aware of the health hazard associated with this challenging moment of coronavirus, the ban in they have no option to come out.
We apologize for that technical hitch there in that report. That's the much we can take from Kaduna Network Center. But let's talk sports. Sports Minister in Jones, Nigeria.